It's Thursday, April 23. This is the news on PBCJ. I'm Carol Francis. The World Health Organization, WHO, has made fresh calls to countries globally to strictly enforce their lockdown restrictions in a bid to slow the spread of COVID-19. The call came from the WHO Director General at a press conference on Wednesday.
Most countries are still in the early stages of their epidemics, and some that were affected early in the pandemic are now starting to see a resurgence in cases. Make no mistake, we have a long way to go. This virus will be with us for a long time. There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries. But this virus remains extremely dangerous. Early evidence suggests most of the world's population remains susceptible. That means epidemics can easily reignite.
The Director General warned against complacency in tackling the pandemic.
One of the greatest dangers we face now is complacency. People in countries with stay-at-home orders are understandably frustrated with being confined to their homes for weeks on end. People understandably want to get on with their lives because their lives and livelihoods are at stake. That's what WHO wants to, and that's what we're working for all day, every day. But the world will not and cannot go back to the way things were. There must be a new normal, a world that's healthier, safer, and better prepared.
Confirmed coronavirus cases worldwide now stands at approximately 2.5 million. At least 160,000 people have died from the virus. For weeks now, local health officials have been warning the country to brace for community transmission of COVID-19. With 252 Jamaicans now returning positive results for the virus, the reality of community contagion is closer than ever. Health Minister Dr. Christopher Tufton painted a sober picture at a virtual press conference at the ministry's Kingston office on Wednesday. Our reporter Marlon Samuels picks up that story.
Wednesday's virtual press conference at the Health Ministry played out in a manner that has almost become a new normal. The Health Minister reported a spike of 19 new confirmed COVID-19 cases, pushing the number from 233 to 252.
So the number of confirmed coronavirus disease 2019 COVID-19 cases has risen to 252, and that's based on 19 new cases that have been received in the last 24 hours. 9 of these, which we just received, we will provide additional information on in terms of male-female split. But 10 we received earlier today. Of that 10, 2 are males and 8 are females, with ages ranging from 20 years to 50 years.
As we reported on Tuesday, the Cobas 6800 diagnostics machine at the National Public Health Laboratory is now up and running. Dr. Tufton says this will allow the country to test over 1,000 samples a day. The increased testing capacity could see a surge in positive results.
We expect to test quite a number of samples over the next 24 hours. We can elaborate more on that later on, but given the new addition, which has now demonstrated its capacity to function accurately, we should see quite a few hundred of samples being tested over the next 24 hours, which could or may adjust the numbers in terms of positive tests.
This point was picked up by Principal Medical Officer and National Epidemiologist Dr. Karen Webster-Carr. She says the 252 confirmed COVID-19 cases are not a true reflection, and that the country is, quote, further along than we are picturing now, end quote.
We are seeing more and more cases that are coming up without links. So it is telling us that we are having more and more local transmission of cases, and the numbers are getting larger and larger. So there is obviously a signal going out to all of us what we're dealing with. And what we are seeing now is the effect of 2 weeks ago. So that we are even more today further along than we are picturing now. So we need to imagine that and to say, we have to do what we have to do now. And so we will see that effect in a week, 2, 3 weeks. So the important thing that CMO spoke about, we have to ensure that we protect ourselves and protect others.
Health officials are now racing against the clock. They are trying to contact, trace, and test in the fastest, safest way to get all the unknown, undiagnosed carriers of this virus before they infect multitudes of citizens and overwhelm an already burdened healthcare system. For the news on PBCJ, I'm Marlon Samuels.
$17.5 million. That's how much is being pumped into information and telecommunication support to the Ministry of Health in the fight against COVID-19. Portfolio Minister Favor Williams says the Universal Service Fund, USF, is providing the funds.
As you are aware, the agency, Universal Service Fund, falls within the portfolio of the Ministry of Science, Energy and Technology. It has upgraded the bandwidth speeds of 59 health facilities across the country. The beneficiaries include health departments and centers, regional offices, and hospitals. The upgraded connectivity is to facilitate an uptick in demand for connectivity by the Ministry of Health, particularly through video conferencing, data transfer, and archiving activities during the national response to the coronavirus. The additional bandwidth will also enable healthcare providers to engage in telemedicine, teletriage, and virtual clinics.
On behalf of the Ministry of Health and Wellness, really want to say a big thank you to the joint-up approach to this COVID fight. These resources will be very useful because, as you know, this fight is a national one and we have to reach right across the country. So the bandwidth and greater reach and data transmission is absolutely critical.
The government is documenting data on the novel coronavirus COVID-19 so as to better understand it, improve its management and treatment of the infection, and boost the resilience of the country's public health system. The Minister of Health and Wellness, Dr. Christopher Tufton, says the ministry's epidemiology unit, headed by Dr. Karen Webster Carr, is leading the research. The ministry is also working with the University of the West Indies, UWI, to document responses being generated through a call center being manned by medical students. And Health Minister Dr. Christopher Tufton is calling on Jamaicans to not discriminate against persons suspected to have or those who test positive for the coronavirus. During a press brief on Wednesday, it was revealed that the police are being called on COVID-positive patients by neighbors, fueling serious concerns about heightened discrimination associated with the pandemic.
And how have they treated with you in that setting?
Very bad, very bad.
Okay, tell me a little about that. I mean, people come to you and say something to you or what? Yeah.
Yes, it's like they behave like I am the one that created the virus, or they will probably say, I know about it and me did spread it because I did want people for dead. How can I know about it when I was tested afterwards and I got the results? I'd have to wait until the results because, as I say, I'm not feeling any illness. And then we talk how I'm wicked and if it dead, then you know them Jamaican persons are.
Right. So how did that make you feel? I mean, knowing that
I'm going to feel bad. I'm human. I feel bad like I did something wrong when I did nothing at all wrong. Sleepless nights, crying, praying that I don't infect anybody or, you know.
A senior nurse also told the health minister that people have been taking cover whenever they see healthcare workers entering their communities.
Concern we have, sir, is the discrimination that is out there. It is real, and persons are afraid. When we go into some communities, persons will say, who in here have COVID? It's who no come for, that sort of a thing.
Right. So once they discern that your Ministry of Health, it's about COVID, and
it is about COVID.
People are running and dodging and hiding because
Yes,
they don't
sir.
want to be identified.
Dr. Tufton responded to the issue.
We have to get the public to appreciate and understand what the public health team has to do, what they are doing, the burden on them, and why it is that all have to cooperate and give them the fullest of support as we tackle this issue.
Contact tracing is the term commonly heard today in relation to COVID-19, but not everyone may understand what it entails. A senior nurse provided some details at Wednesday's press briefing.
What is contact tracing from your perspective?
Okay, from my perspective, I would say contact tracing in public health is a detective work. What we actually do, we find the index case of the person who is infected with a disease, and in this case, we are referring to COVID-19. Then we ask the person for the names of all the persons he or she may have come in contact with during that period. And we ascertain from that individual the duration of the time, whether they had maintained the 3 to 6 feet distance, how long they spoke with the person. And when we get that information, we get name, addresses, telephone numbers of those persons. Then we go ahead and we call all of these persons, and we do what we call a double back check-in. So the same questions we ask the index case is the same questions we ask the other persons who may have come in contact with the index case. So, for example, we would ask, when you spoke with the person, you were in a ventilated room, was the AC on, was the window open, were you in an open space, were you sitting close beside the person, was the person wearing a mask when you spoke with them? Those are the sort of questions we ask. The purpose of this now is to trace all the persons who may have come in contact and therefore is at risk for getting COVID-19.
There's a hold on chicken importation for now. The Minister of Industry, Commerce, Agriculture and Fisheries made the announcement on Twitter. Minister with Portfolio Responsibility, Audley Shaw, is quoted as saying, "We are doing this against the background of COVID-19 with a surplus in the country now. The priority is to consume what is produced locally," end quote. Analysts say there are approximately 8 million kilograms of chicken currently in storage across the island. The National Commercial Bank Jamaica Limited (NCB) is advising that in keeping with the government's most recent orders, branches in St. Catherine will reopen on Friday, April 24. The branches will open 3 days per week on Mondays, Wednesdays and Fridays from 8:30 a.m. to 12:30 p.m. until further notice. For the latest in the world of business here in Jamaica, we join Gabrielle Thompson in the Business Report.
Gas prices are to go down by $3.06 on Thursday. The state-owned oil refinery Petrojam says E1087 will sell for $116.67 per liter and a liter of E1090 for $119.50. Meanwhile, automotive diesel oil will go down by $3.06 to sell for $113.90 per liter. Kerosene will move down by $3.06 to sell for $96.38 per liter. Propane cooking gas will move up by 97 cents per liter to sell for $38.12, while butane will go up by 25 cents to sell for $47.72 per liter. Retailers will add their markups to the announced prices. In Wednesday's trading session, the JSE Combined Index declined by 1,943 points to close at under 400,000 units. Overall market activity resulted from trading in 79 stocks, of which 25 advanced, 40 declined, and 14 traded firm. The Junior Market Index declined by 15 points to close at under 3,000 units. Stocks advanced for Barita Investments Limited, Blue Power Group, and Caribbean Cement Company. Stocks declined for Access Financial Services, Berger Paints Jamaica, and Caribbean Assurance Brokers Limited. Trading firm were 138 Student Living Jamaica, AMG Packaging and Paper, and CAC 2000 Limited. QWI Investments Limited was the volume leader with over 91 million units, followed by Mailpack Group Limited with 68.1 million units, and the Linmas and Bars Limited with close to 42 million units. Now for the foreign exchange, the US dollar on Wednesday, April 22, ended trading at $140.45. The Canadian dollar sold for an average $105.76. The pound sterling traded for $172.18, and the euro ended trading at $140.74. Oil rose on Thursday, spurred by rising tensions in the Middle East, output cuts by producing nations to tackle oversupply, and the promise of more government stimulus to ease the economic pain of the new coronavirus pandemic. Brent crude futures gained $1.60 to $21.97 a barrel. West Texas Intermediate crude rose $1.74 to settle at $15.52 a barrel. That's it for the business report on PBCJ. I'm Gabrielle Thompson.
In this week's episode of Culinary Trails, Simone Absalom pulls together the love for history, culture, and food, which can all be had in a takeout container.
This week on Culinary Trails, we begin a two-part series looking at takeout menus and services offered by restaurants. The demand for takeout has increased since restaurants have closed their dining area to minimize the risk of a COVID-19 transmission. Our first stop, Fromage Brasserie. Their French-Jamaican cuisine serves up delicious meals like tamarind glazed wings, seafood mix, pastas, yummy sandwiches, and more. Get your food delivered for only $500 or free with orders over $5,000 from Fromage Bistro at 8 Hillcrest Avenue or Fromage Brasserie at Marketplace. You can also opt for curbside pickup. Chilitos Jamexican Restaurant and 7 Crave Jamaica are partnering to offer free delivery to Kingston locations for orders $2,500 Jamaican and over.
As I said, Chilitos is a vibe, and we definitely want to keep the vibe going, and what makes people feel good is coming here and getting a really good deal. Our prices are generally very affordable, but we have our special days where we make it a little extra special. So on Mondays, you can come in and for a Margarita Monday, which is discounted margaritas. Tuesdays is Taco Tuesday, which is an institution that we're very proud of. And then on Fridays, you can get Burrito Fridays, where you get a burrito for $600, and it is still a belly full.
Do you do takeouts, or do I have to come to the restaurant to get these good food?
You can do anything you want and everything in between. We have a takeout window right around the corner right there. You can walk up, get in and out really quick.
Delivery is free for everyone in the Ligony, Barbican, Muna, and New Kingston area. Next week, we'll delve deeper into the world of takeout and how you can sate your cravings while you tan a yard.
In regional news, Trinidad and Tobago's National Security Minister Stuart Young says citizens are jeopardizing the safety of the nation by finding loopholes in these stay-at-home orders. The orders are part of measures to stem the spread of COVID-19. He addressed the Ministry of Health press briefing on Wednesday. TTT News' Ian Watson reports.
The stay-at-home order had some businesses wondering whether or not they were essential. Some apparently went further and attempted to make themselves essential. This according to National Security Minister Stuart Young.
Persons buying maybe 10 loaves of bread, putting it in their storefront and claiming to be a bakery. Persons all of a sudden selling mops and brooms and some disinfectant and saying that they are a grocery store.
Minister Young added people are also looking to find all kinds of loopholes to get around to posing as essential businesses. He said doing that will only bring more harm than good. The National Security Minister also gave the police service his full support as he acknowledged the job they are doing. This despite displeasure expressed about the traffic as a result of the roadblocks and stop-and-search exercises across the country.
Police officers conducting roadblocks, etc., do so within the ambit of the law. No one is seeking to use the stay-at-home regulations. So to try and draw distraction and mischief on that basis, I'm going to deliver food or I'm going to pick up food for my girlfriend, is an unnecessary distraction and not one that the police service will be distracted by.
Minister Young reiterated that the borders are not open, despite 33 nationals returning home from Barbados on Tuesday. He said an SOE is right now not in the government's plans. Ian Wason, TTT News.
Guyana's Deputy Chief Medical Officer Dr. Karen Boyle has expressed grave concern over the flouting of anti-COVID-19 measures by citizens. Gordon Mosley of News Source has the details.
The Deputy Chief Medical Officer of the Ministry of Public Health, Dr. Karen Boyle, is sounding an alarm that Guyanese need to get their act together if the country is to really beat the coronavirus soon. In a telephone interview this afternoon with News Source, Dr. Boyle said too many persons are still being irresponsible by not following the guidelines put out by the health authorities, especially when it comes to avoiding public gatherings.
I'm a little disappointed. I mean, some people, some workplaces are definitely doing what was asked, and I'm proud of them. But there are the elements who still drinking on the roadside and, you know, having unnecessary, these big strappy men with plenty muscles, with little bird, this thing in the cage, meeting on road corners and doing that nonsense still. Those kinds of things are not necessary, and that is unnecessary social interaction that could expose people to stuff.
Although Guyana has put in place a partial lockdown and curfew, many persons have still been spotted liming at the drinking spots and in the marketplaces, forcing the police to be conducting raids. The Deputy Chief Medical Officer explained that the time may be approaching when the authorities might have to become even tougher with sanctions.
I suspect that if we don't get our act together, as in the people get their act together, and really understand their social responsibility, then I guess there may come a time where the government may have to look at, you know, tougher measures, I guess. My worry is this period may finish and if we don't achieve our objective, you know, being able to contain it. I know already, without us having finished, we are already seeing some drastic improvement.
But now medical officials are also facing an additional headache, with many of the persons who have been tested positive for the coronavirus refusing to provide information about their contacts and places that they might have visited in the lead up to their positive test. That problem is creating a major hurdle for the Public Health Ministry in its efforts to fight off the viral disease.
Those cases that we have, those persons who we know had corona, you wouldn't believe how difficult it is to get them to cooperate with sharing the names of their contacts and the places they went to. I don't want to say it's selfish, but for some reason, they're not forthcoming with that information, and that makes our job of containing spread so much more difficult when we don't know where to look in terms of who are the persons that may have come into contact with these cases and maybe the next potential case. That is the only way to stop spread, is to get there before the person manifests and put them in quarantine. And if they manifest, they've already been quarantined, so they didn't get to spread to somebody else. That is the way to stay ahead of the disease. But if we deny that information, then it really weakens our ability to do what we're supposed to do and what we can do.
Dr. Boyle said health officials are also faced with some contact persons also refusing to cooperate with them when they have been identified by those affected as possibly being exposed. Dr. Boyle reminded that the fight against the coronavirus is a national effort, and therefore everyone must take it seriously and do their part and play their role to assist the health workers. Guyana has recorded 67 confirmed cases of the coronavirus, with 7 of those cases resulting in death. The first case in Guyana was recorded on the 11th of March.
In sports, we bowl off with cricket. Jamaican batsman Chris Gayle is expected to suit up for a different team if the Caribbean Premier League CPL gets the green light to go ahead with the tournament slated from August 19 to September 26. Gayle is expected to sign for the St. Lucia Zouks. This after the legendary left-hander was not retained by the Jamaica Tallowers. If the move materializes, it would be Gayle's third CPL franchise since the tournament began back in 2013. And staying with cricket, Sammy will return as skipper of the St. Lucia Zouks for the Caribbean Premier League CPL 2020 season. Sammy, who recently finished a coaching stint in Pakistan, will be back in his playing shirt with his home franchise, which he has appeared for since the CPL's inception in 2013. The 8th edition of the tournament is scheduled to take place August 19 to September 26, but organizers are keeping an eye on the COVID-19 pandemic and liaising with medical advisors and governments to determine if play will go ahead. Over to athletics. President of the Jamaica Athletics Administrative Association, Warren Blake, is supporting the suggestion of a one-off World Under-21 Championship next season. This as many young athletes have lost their final opportunity to compete at the World Athletics Under-20 Championships in Kenya this year due to the COVID-19 pandemic. If the meet goes ahead as an under-20 meet, some of Jamaica's prominent student athletes like Edwin Allen High's Kevona Davis, former Very Technical High School star hurdler Brittany Anderson, and Calabar's Kimara Farquharson will miss Nairobi. The Jamaicans and the St. Lucian Julian Alfred, who has accelerated her sprinting in her first year at the University of Texas, will be ineligible for under-20 competition next year. And that's our package. Join us again same time tomorrow for more news and sports right here on PBCJ, the People's Station.